To ensure that we collect relevant feedbacks, we did a rapid prototype for our customers to get a feel and touch of the system that we are going to develop. So we developed a prototype that we used to collect the feedbacks in Kerege Hospital, which is one of the beneficiaries of our services. After that, we went to the District Health Coordinator office in Bagamoyo to get his office's view on the system and areas that we need to work on to get the developed system respond to the challenges effectively. The Mary Stopes Hospital, which expertises at maternal and reproductive health, was ready to support this initiative. Our visit to the Kerege Hospital solicited inputs from mothers there and the nurses, but we introduced the system by taking them through the basic modules of the system and how it works. In the end, we showed them how we are going to develop it and our team's involvement and collaboration with the nurses at Kerege to ensure that the system is developed.
Kama sisi team tuliona kwamba hii inaweza kutatua matatizo ya kiafya, especially kwa sisi akina mama, wasichana ambao tunaelekea katika mambo ya familia, especially katika issues za kama alivyoelezea kudiagnosis mwenyewe na swala aliongezea sasa hivi la kadi, kwa sababu katika utafiti kwa tunaangalia mtu anakuja kliniki kama hivi katika zile production itasahau kadi.
After training the mothers and nurses on how the system works, we got them through the prototype, where we showed how the prototype is, especially the Android part, and we had time for them to give in their inputs and feedbacks regarding the touch, the feel of the prototype. After that, we went through a series of questions and answers, and we went through a one-by-one introduction to the prototype for them to get a close feel on how the prototype works. This was an exercise which took a while to get the mothers knowing the system, knowing how it works, knowing how we can collect feedbacks, knowing specific questions which were prototyped with the prototype that we developed, and getting feedback regarding specific questions on maternal health and reproductive health. After that, we ensured that everyone was getting their inputs to the system development. So we went through a series of questions, specific questions, close-on questions and responses, for which they were very eager to give feedback in. Most of the feedback were around the ease of use of system, the technology, and how it was going to ensure that mothers who are living in the remote areas are actually incorporated as well, even when they don't have a knowledge bigger for a technology that we are using in some areas. So we collected all those feedbacks and the inputs from them, and we ensured that every single input that was supposed to be captured was captured. The nurses gave their contribution on how the system is going to be deployed in their hospitals, and we discussed on the capacity buildings that will involve the nurses and other medical officers in the hospitals like Kerege and other hospitals in Bagamoyo and in other areas like Kilosa. There were also concerns about people who are living far from the town areas, and they wanted that all these issues are taken care of during the development phase of the system. And the inputs that we received are very valuable for systems development. Aha. Kama una smartphone hizi, kwa sababu za WhatsApp tunasema ni smartphone ambayo ina system kama hii ambayo tunaitumia. Unaweza ukatumia pia kwenye simu kama unavyofanya M-Pesa, unavyofanya hii mobile bank, unaingiza star 50 ngapi ngapi. ile tunasema ni USSD technology, ile ambayo simu zote inafanya, hata kama ni simu kama hii au ikawa simu ya touch au ikawa simu yote ambayo haina mtandao, unaweza ukatumia. Kwa hiyo tunataka hii service isiwe kwenye, ipatikane kwa aina mbalimbali, kwa teknolojia mbalimbali, ipatikane kwenye simu za WhatsApp, za smartphone, ipatikane kwenye simu ambazo sio smart, simu za kawaida.
Mtu wa Mtwara au yuko Mtwara anaweza kuingia kwenye eneo ambalo kwa Kigoma.
Turudi tena kukaa chini kuangalia kwamba tatizo liko wapi, ili tuweze kufanyia kazi, kila mtu afurahie hii huduma na aweze kutumia vizuri. Kwa ina maana ni mwanzo hapa na kila sehemu itakayotumia.
Kwa hiyo sisi tunapoishi kule, ina maana yani huduma ni ngumu, hata
yani mnakaa mbali na yani mmetoka mbali. Ni kilomita ngapi?
Yani hapa nisema ni mbali kidogo.
Kama kilomita 5 zinafika.
Ni mbali.
We know what we're so how fast yani kwamba hata sio umekomplete kwa sio daktari anapata alert gani kwamba hii mgonjwa anaweza kupata jibu nini mtaalamu unauza sasa hiyo how do we consider huyo daktari? Yes. Na maybe sijataka juu hata kwenu kuna watu wa mtandao.
Our core business is to ensure that girls and women have children by choice, not by chance. So we're trying to make sure they have safe motherhood, they have all the necessary services that a mother would need, a pregnant mother would need in time of pregnancy. Now we also have outreach programs that usually try to reach those women and girls who are in unreachable and not easily accessible areas. So I believe as far as this system is concerned, maybe it is going to bridge that gap that is currently existing, whereby I as a doctor have to go an extra mile to reach someone who is in an interior village or neighborhood.
So you are stressing that our system should focus maybe on using the USSD technology rather than the mobile and the smartphone and the web-based. Maybe we should focus on the USSD.
Yes, because we all know that even the web-based applications here in Ghana are not always that much accessible. So you can imagine areas whereby even the network, the normal network, is not reachable. So I think if you can use, what did you just?
USSD.
Yes, USSD. One thing that I think I should also make very clear is you should not only target doctors. They are the very people that are in very close contact with pregnant mothers and nurses. So whatever plans you're doing, you should not exclude them. And they are very practical as far as the issue is concerned. And in most cases, these are the people that can reach these mothers out there remotely as compared to doctors.
It's a big system. It's going to be utilized remotely by so many people, and it has to come with different technologies, USSD, a mobile application, Android mobile application, but as well as a web system. What is the capacity?
Yeah, okay, thanks. I mean, we at Maternal, we do a lot of software development, and it's not like this is our first project. We've done a number of similar projects. Like I was explaining to you earlier, we did a similar project with the Ministry of MUHAS, the hospital, Mumbai Hospital, okay, which is working exactly more or less the same of what you guys are doing, which was it's a mobile application running on different platforms, as well as it had USSD, and it was capturing data like what we did with your application for capturing the same information. And once that data is captured, we're able to process it and show it on a can now do your analysis and get feedback. So it's not simple. We are able to do it, and we've done similar or bigger projects like that. So
The input received from Bagamoyo Hospital, Kerego Hospital, Mary Stopes, and Noxt are very important. We are going to incorporate them in the designing and developing the system. The nurses contributed, and everyone who was involved contributed. In the next step, it's down to us to incorporate all the inputs. The feedback ranged from how the users are going to use it, how the nurses are going to use it, and the benefits that the nurses, doctors, and the users themselves are going to get out of the system. It is clear that we need to make this system a very working and beneficial system for all the beneficiaries, coming in different technologies, but making it easier for them to use in their daily lives. Going forward, we are going to ensure that everyone who has to benefit from the use of this system benefits from it. We are going to train the nurses, capacity building to the users, to ensure that they use the system without any stumbling blocks. We are very grateful for everyone who participated in building this system, and it wouldn't have come at the right time when there are floods in the city due to rain that is going on, the difficulties accessing the resource centers, especially health centers for the mothers. The bridges are breaking down, and it is difficult to access the services that are important for lives. The questions that we received from the users are going to be incorporated and are going to refine further the idea and make sure that it evolves to a better system. We are very thankful to everyone who contributed.